this insulin will carry the sugar into the body tissue where it will be used for energy production. So today we'll look at gestational diabetes mellitus. This is replying the question I got from one of my followers on TikTok. So we'll start by understanding first of all what is diabetes mellitus. Okay, so DM, diabetes mellitus. What is diabetes mellitus? Diabetes mellitus is a condition where there is chronic hyperglycemia as a result of insulin deficiency or insensitivity of insulin. So there is chronic hyperglycemia. Okay, now what is hyperglycemia? Hyperglycemia means there is what? Excess sugar in the blood. Excess sugar in what? Blood. So when somebody has excess sugar in his blood, that is what? Hyperglycemia. So in diabetes mellitus, there is chronic hyperglycemia. That's hyperglycemia that has been for a long time. Okay, now this is as a result of either insulin deficiency or insensitivity. So there is insulin deficiency, okay, or there is what? Insulin insensitivity. Okay, so either these two can occur together or they can occur in isolation to cause what? Excess amount of sugar in blood, and that is what? Your diabetes mellitus. So this and this put together gives you what? Diabetes mellitus. So insulin is produced by an organ in the body called pancreas. So the pancreas in this shape, okay, it has tail, it has body somewhere at the center, and then the head. So head, body and tail of the pancreas. So this pancreas now is the organ that's what? Produces insulin. Okay, it gives what? Insulin. So if there is any problem with this pancreas that will reduce its production of insulin, it can lead to what? Excess amount of sugar in the blood, because this insulin is needed to move sugar in the vessel towards to the body tissue. So if this is the blood vessel and you have this black represents your what? Sugar. So this insulin is needed to drive them into body tissue. So let's say that this is the insulin. So that is the channel, and then here represents body tissue, which could be muscle. This insulin will carry the sugar into the body tissue where it will be used for energy production. So when this insulin is deficient, therefore the sugar remains in the what? Vessel. This is the sugar. So when this condition presents in a pregnant woman, it is called gestational diabetes mellitus. Gestational because pregnancy is what? Equivalent to what? Gestational or gestation. So in pregnancy, there is increase in the amount of energy needed for the mother and the baby. So there is also an increase in the amount of insulin needed for the pancreas to secrete so that it can move the blood sugar to the body tissue. So normally there is increased blood sugar. Okay, blood sugar is increasing. So when this increase in blood sugar is not being matched with an adequate increase in insulin, then there will be excess amount of blood sugar left in the vessel. Okay, so there will be what? Hyperglycemia. So in this condition, the insulin may be low or it might not be increasing. So these two put together will give you what? Your gestational diabetes mellitus. So in my next video, I'm going to describe those groups of pregnant women that will have diabetes mellitus. Okay, so if you have learned anything from this video, please consider subscribing to my YouTube channel, follow my page, and like this video, and please share this video so that as many people as possible will see this video and learn from it, and then create more awareness about this gestational diabetes mellitus. And remember that at the end of this video, I will show you what you should do to avoid having diabetes when you are pregnant. Okay, thank you, and I shall see you tomorrow.